Woo, we are on record. Alright. Hey everybody. I am William. I won't give out my last name. It's a pretty funny last name. But anyway, I'm not going to do this whole big old introduction because I know you guys just want to just get straight to the point. You want to know what an ER tech is. What do we do? This and that. Salary. I know it's a big question that comes out of people's mouths. But before we get started, I do think that it is necessary, and it's only right that I can kind of let you guys know who I am. So, you know, you won't be looking at me like, who the hell is this guy? How does he know all the blah, blah, blah. Okay, so I'm William. You can see that I am an emergency room technician, ER tech. I have been working as an ER tech now since July the 30th of this year. So I am so very new. But my healthcare experience is not new. I have worked as a patient care technician since the age of 19. I've worked in the hospital since I was 19 years old as a patient care technician. So that's about over 5 years now I've done that. And my job offered the position. I interviewed very well, and I'm now working as an ER tech. So first question, what is an ER technician? A ER technician is a technician that's similar to a patient care technician in regards to your role in the unit. You know, you are to report to the nurse and then to the doctor. So them two are working over you, supervising you. But we're just in the ER now. What ER techs do for the most part, we start IVs, we do blood draws. We perform EKGs. We splint patients with broken extremities. We do a lot of stocking, maintaining stocking, especially with our crash carts, and we test machines and all that. We're pretty much the I want to say the real workers of the ER. No disrespect to any other nurse or physician working the ER. I'm just saying. But yeah, man, as an ER tech, it's a huge job, trust me. And if you're which leads me into my next question, to my next answer. If you are a current CNA or phlebotomist or certified EKG technician or whatever the case may be, I think your next question is, how do I become one? Can I transfer what I already have to become one? So to answer that question, I think it's important that you all understand that different hospitals have different requirements in order to fulfill their ER technician job. What I've been seeing is that most hospitals want their ER techs to either be EMS workers or paramedics or medical assistants. I think even phlebotomists can do so as well. I think that as long as you just have some type of healthcare background, then you can do it, especially if you have some phlebotomy experience, because there is a lot of phlebotomy involved with becoming an ER tech. That's weird though, because with me as a patient care technician, I wasn't allowed to even touch a needle inside the hospital, and now on the first day I'm sticking over 15 people. So it's a learning experience. It's really, really fun, but definitely a learning experience. What would be the next question? Salary. Yeah, people want to know about salary. It's the same thing, man. If you're a tech and you're working inside the hospital, any tech, I don't care whether it's ER tech, radiology tech, patient care tech, tech, whatever, you're gonna make between 11 to, I think the highest I've heard is like $18 an hour. So yeah, that's it. So between 11 to 18 an hour you can expect to make. The schedule, uh, I paused for a minute because the ER I've seen is a little different than working the floors. The ER, you can have a 3 p.m. to 3 a.m. shift, or a 3 a.m. to 3 p.m. shift, or 11 p. to 11 a.m. shift, or vice versa. But me personally, I'm working a 7 a.m. to 7 p.m. shift. I've been doing that for over 5 years now, and I'm pretty content with that. But just 3 days a week, and any day you work after that is considered to be overtime. So that's about it with the scheduling. Any other questions or things that I'm missing? So we answered what is an ER tech. We answered what is the salary, our job responsibilities, the hours, and how you can become one. So let me just definitely just try to just stress that. Just talk about that one more time as far as becoming one, because that kind of confused me as well too. You just need some type of healthcare experience, and I don't think that it's necessary. You might check with the place that you want to apply, but I don't think that it's necessary for you to have some type of phlebotomy experience. But I do know that ER techs are required to initiate peripheral IVs and to stick patients and draw blood. So just check with the requirements and everything, and you should be good to go. But do I like it? I love it. It's very different from just working as a patient care technician on the floor. Very different. So especially if you're like me and you're trying to go into nursing school, you are going to love it. It's a completely different experience, and right now I can't say anything bad about it, but I've only had like one actual working day. So if this video does well, if you all respond back to me well and you have more questions, then I will definitely make more. And most importantly though, I'll increase the quality, get a better camera, and just spice it all up for you guys. But yeah, so I hope that helped whoever it needed to help out, and let me know. Thumbs up.